Hello, my friends. Andrew Kornfeld here. So, in today's video, while I enjoy this incredible matcha from the Yame region of Japan, look how green it is. So amazing. We are going to be talking about the difference between inflammatory bowel disease and irritable bowel syndrome. That's IBD versus IBS. And let's remember that IBD is Crohn's disease, ulcerative colitis, and the rarer types are indeterminate colitis and microscopic colitis. And then something called irritable bowel syndrome. So buckle up, you do not want to miss this, okay? We are going to be going through a systems-based approach to both conditions, how I address these conditions with my clients, and how systems-based health coaching, SHC, and Systema approaches these two conditions. Buckle up. It's going to be an amazing journey here. It won't be too long. We're going to uncover the biology of these conditions. We're going to understand the basics, and then we're going to go through a 3 and 4 step respective process for each condition. Let's go. All right. So, look, let's start with the names of these two conditions. Inflammatory bowel disease versus irritable bowel syndrome. What is the first difference? The first is that one is predominantly based in inflammation and the other one is based in symptoms, irritation, okay? Inflammation versus irritation. The second distinction is disease versus syndrome. Irritable bowel syndrome, inflammatory bowel disease. A disease is a specific diagnosis. A syndrome is a collection of symptoms. And I think the if we just had to like really boil this down and to tell you the distinction between them, and look, people get these things mixed up all the time. When I go up to people and I say, look, I have Crohn's or I have IBD, they say, oh man, I've totally got that too. And I'm like, no, you're probably referring to IBS. And you very well might meet diagnostic criteria for IBS because in some ways, we'll go into this in one sec, but IBS is code for we don't know what the F is wrong with you, okay? And so while IBD could be considered worse, and that's a general statement, but overall it's a defined and more likely severe diagnosis, IBS is certainly more mysterious of the two. Some other differences we see between them, for example, is the overall prevalence of this, the incidence. We see that maybe 1 to 2% of the population is affected by inflammatory bowel disease, whereas up to 10 or 20% of the population would meet criteria for IBS. So, what are the symptoms of each condition? So obviously in inflammatory bowel disease, the symptomatology can be more serious, weight loss, severe diarrhea, and there can be constipation as well in IBD. That doesn't necessarily indicate that, but bleeding, mucus in the stool, it causes significant problems. And you can see it on a colonoscopy, and you can see clear markers of inflammation, such as calprotectin, such as C-reactive protein that's activated. Whereas IBS, again, it's not so specified. And when you do a colonoscopy on someone who doesn't have IBD but has IBS, it oftentimes will look like a totally normal colonoscopy. But that doesn't mean that someone with IBS doesn't experience pain, doesn't experience either diarrhea or constipation or a mix of both of them. That doesn't mean they don't experience bloating and pain. And again, so there is this significant overlap between the two. Okay. And it appears that maybe 30 to 40% of people with IBD experience IBS-like symptoms, even when they're not in an active flare. And so we could say that is an overlap between the two. So let's just start here with, and this is a blog post that I wrote. Let's start with the mechanism. Okay, so in inflammatory bowel disease, there's obviously, it's a perfect storm, as I've talked about. It's a combination of genetic, microbial, environmental, psychosocial factors that contribute. Same with IBS that we'll go through in a second. But what's happening is that there's some sort of dysbiosis, and that means that there's a dysregulation of the microbiome. Now, this is more prominent. It is more prominent in inflammatory bowel disease than in IBS, but there are microbial dysbioses that we see in both conditions. And in inflammatory bowel disease, there is a breakdown of the mucosal membrane. There is a leakage into an area called the lamina propria. And when I say leakage, that is specific bacterial organisms, as you can see in this schematic that I put together right here, or food particles. And then when they get to this area called the lamina propria, which is this area right, beneath that first layer of cells, beneath that epithelial tissue, there is an inflammatory response to this microbe. And that's what causes all the inflammation. In Crohn's disease, it's often the inflammation is in the terminal ileum, and it's what we call transmural. It means that the inflammation goes through all the different layers of cells. In ulcerative colitis, it's surface level, it's more superficial. Inflammation, it's more defined to the colon. Crohn's disease, the inflammation can be anywhere. But the difference is that you can see it on a colonoscopy most of the time. There is oftentimes much more debilitating symptoms. Again, people with inflammatory bowel disease experience a lot of extra intestinal manifestations. Lots of different problems happen with the body. You're not digesting your food. There's significant weight loss. It is a more serious condition most of the time, but it's also more defined. Where once we start going into IBS, it is a similar mechanism. It is a similar mechanism, except the immune response is lessened. And rather than there being this enormous immune response to that bacteria and those possibly food particles and other things that are leaking into the lamina propria, there's activation of what's called the enteric nervous system, the ENS, which then stimulates the CNS. And then after the CNS is then activated, we see all of these alterations in smooth muscle contraction, in gut motility, in bowel movements. This is what results in either constipation or diarrhea, and what we call visceral hypersensitivity. That's right there, visceral hypersensitivity. And that's an intense pain perception in the bowels. Now, remember with inflammatory bowel disease, I said there was 4 different types. There's, Crohn's disease, ulcerative colitis, indeterminate, microscopic. And in microscopic with IBD, you can't see it, but it is not the same as IBS because it's much more inflammatory based and you can see it on the microscope. In IBS, there's 3 different subtypes. There's a diarrhea dominant subtype, there is a constipation dominant subtype, and there's a mixed, and actually there's also undefined as well. But generally, when we're talking about it, generally the 3 come up, which is diarrhea dominant, constipation dominant, or mixed. And here's a much more detailed schematic from an amazing paper, an amazing review paper that recently came out, and I'll link to that in the description. But we can see that, here we start with environmental factors as always. These conditions, both inflammatory bowel disease and IBS, our ancestors did not experience these things. So it's obviously something in our environment. Obviously, there are genetic factors right here. And there's psychological factors that really play a role into IBS. Now, that doesn't mean they don't play a role in IBD. They do. But there's even more of a psychological component of IBS and continues to help us demystify the connection between the brain and the gut and between our emotions and the gut. So essentially, after we see the increased permeability, which you see right here, which again is continued to be influenced by antibiotics, by our diet, all of that, there is low-grade inflammation that happens. And then again, what we see is there is this mucosal barrier dysfunction. This is very, very similar to IBD. And we see this connection then rather than there being this enormous inflammatory response that we see in IBD, we see through the CRH and HPA axis, which is a part of the brain, we see this activation of the central nervous system by the enteric nervous system, which then causes smooth muscle contraction, which then leads us to visceral pain, visceral hypersensitivity, and either diarrhea or constipation, or a mix of both. And again, this is a very detailed molecular biological schematic of what is happening in irritable bowel syndrome. This comes from this Molecular Mechanisms, Microbiota Mediated Pathology in Irritable Bowel Syndrome, and it's an open source article. So they're two different things. Let's review here. IBD is very defined, it's worse. IBS, it's more common, less defined, more mysterious, not as life-threatening, for example, as inflammatory bowel disease, but it can be very, very serious, and it can be very complex in how to approach it. And it is also true that the ENS and CNS play a role in inflammatory bowel disease as well, but they don't play as predominant of a role that they do in IBS. So let's go through. Let's look at IBD one more time. There's dysbiosis, okay. There's permeability, and then there's inflammation. So in inflammatory bowel disease, we need to disrupt this cycle. And there's a 3-step process that we have at Systema IBD that we've worked with hundreds of inflammatory bowel disease patients. I mean, this is really what I've done for many years. And the 3-step process is, number 1, stop and control inflammation. Okay, so in inflammatory bowel disease, stopping the inflammation oftentimes might involve using a corticosteroid. It might involve using a different biological medication, depending on what your GI has in mind. It could involve, other ways that are more natural, but then there is a difference between stopping and controlling inflammation. And stopping inflammation is generally done with a higher tier medicine like prednisone or budesonide or a steroid, like I was saying, or an anti-TNF medication, or one of the newer medications like a JAK inhibitor. Whereas controlling the inflammation is much more about eating anti-inflammatory foods, all the anti-inflammatory supplements that we have. So that's the first step right there. Then I have modulate and nourish the microbiome. Now, I used to only say nourish the microbiome, and I was always a little bit more skeptical on modulating the microbiome. This is also something that's really important in IBS, but modulating the microbiome means, I like to think of it, if we just had to think of it from a really simple standpoint, it means creating a harsh environment for inflammatory microbes that might be existing, or more harmful microbes. And modulating the microbiome can be accomplished in a myriad of different ways. It can be obviously with antibiotics, which we like to avoid in IBD and generally IBS, but there's one antibiotic that I will bring up that might be implicated in both IBD and IBS that I don't think, gets enough attention, but it played a role in my disease course as well. It's called rifaximin. We'll go into that in a second. But also we can think about modulating the microbiome with diet. That the microbiome primarily, the food source for the microbiome is primarily complex carbohydrates, starches, and fibers, for example. So if we reduce the amount of starches, for example, in inflammatory bowel disease through a diet called a specific carbohydrate diet, or being more paleo, essentially, or even, the ketogenic diet, we can modulate the microbiome. And then nourishing the microbiome involves prebiotics and probiotics, things like fiber and flavonoids and polyphenols, which are also one way to control inflammation. We'll go more into that in one sec. We'll go into both of these. And then there are specific probiotics that are implicated in inflammatory bowel disease. For example, we'll go into that down here in just one sec here. And then we have repairing and maintaining the barrier. And there are many ways to do this in inflammatory bowel disease, but for example, in IBD, just one simple way is to not just overload your system with a bunch of raw vegetables. Make sure that you're blending your foods really, really carefully. You want to, when you have open wounds inside of you with something like Crohn's disease or ulcerative colitis, you want to make sure that you're basically like eating like a baby. Okay. Now, there's a 4-step process that I have for IBS. The first is to calm the nervous system. And look, this is an important step in IBD, but it just doesn't quite make the cut because, again, we see this significant connection between the ENS and the CNS in IBS, okay? And your first step is to calm the nervous system. And there's many ways to do this. There's an entire app that we'll go into called Nerva. There's hypnotherapy. There's meditation. There's, hot and cold. All of these different strategies, just getting yourself in a calm place. Then same step, modulate and nourish the microbiome. In IBS, for example, it might be less related to specific starches, but it can, which is like in SCD when we see it with IBD, and it might be more related to what are called FODMAPs, and those are specific types of foods. And we're not going to go super into that in this presentation here, but that allows for modulation. And then nourishing the microbiome same way with prebiotics, specific prebiotics that don't bother you, okay? Often people, you're going to find your yes, no, and maybe foods and using the adaptive dietary framework, which is one of the tools we have in our program. That's how we delineate between what foods are working for us and which ones are not. And again, there's specific probiotics that are implicated, specific strains that are implicated in irritable bowel syndrome. Now, I don't have repair and maintain the barrier because there's literally not as much physical damage right there, but there's also an element of leaky gut that is associated with irritable bowel syndrome. So we must work to seal the barrier. And then this last step, quell inflammation. I don't have stop and control inflammation in this really hardcore way. It's not, taking hardcore immunosuppressive therapies like prednisone or anti-TNF drugs or even 5-ASAs, mesalamine, or those types of things are generally not recommended in IBS, but there is inflammation. There is immune system activation. You can see right here, this low-grade inflammation that's associated in IBS. So what are some, let's take a slightly deeper dive into inflammation. How can we do these things? There is evidence to suggest that curcumin helps in IBS, and all of these things, in my opinion, help with quelling inflammation and in controlling inflammation in IBD. These are things like vitamin D, omega-3 fatty acids. Again, you want to make sure that your omega-3 fatty acids are in the triglyceride form. Quercetin, quercetin is literally one of the unsung heroes, I think, in inflammatory bowel disease, especially. There's a lot of research to suggest the power of quercetin, which is a specific flavonoid and polyphenol. Curcumin, there is specific evidence in both, and a lot of evidence in inflammatory bowel disease and evidence in IBS as well. And then again, other flavonoids and polyphenols. Remember, I've got my amazing matcha right here, full of flavonoids and polyphenols. A specific one in green tea is called EGCG. And like I said, the inflammation in IBS, it really is tied more to this connection between the brain and the gut. And maybe the inflammation in IBS is less, you could say it's less provoked by the microbial environment. But that does not mean that the microbial environment does not play an important role in IBS, and we'll get to that in 1 second here. Here's some examples of flavonoids. I think all of these foods are extremely important in both conditions, and I think the power of flavonoids is really underrated here. And so this is just a little diagram of the base structure of a flavonoid where you're going to find all of these. These are in like dark berries. pomegranate juice. This contains a specific one called resveratrol. Green tea contains EGCG. And then you see other flavonoids, anthocyanins, that we see in the dark berries, dark fruits. Okay. I would say citrus, for example, probably a little counterindicated in both conditions. Probably not going to be as helpful to you. But again, you are going to be making your list of yes, no, and maybe foods, what's working for you, what's not, all of that stuff. And then here we have just another diagram right here of this gut-brain axis that you guys can look more into. So I want to just really talk to you about the microbiome and dysbiosis and how we modulate the microbiome and then nourish the microbiome. So again, there are lots of ways for us to modulate the microbiome. I think I don't mention this in detail in this blog post, but I think one interesting antibiotic that I don't think has been explored enough in either condition is rifaximin. Rifaximin or Xifaxan is the brand name. Rifaximin is a gut-targeted antibiotic, and it appears to not have, any of the more serious, devastating effects on the microbiome as opposed to, hardcore antibiotics like, Flagyl or something like that, for example. And we can think, I would say we can think about modulating the microbiome in two different ways with IBD and IBS. In IBD, I believe that the best way generally for most people to modulate the microbiome is to avoid starches. Okay, very, very like that. These are things like rice. These are things like obviously gluten containing products, pasta, bread, different grains, super starchy vegetables more like potatoes. There's not all starchy vegetables are created equal. Things like zucchini and squash, pumpkin, those things are generally more of the type of starch that doesn't feed into dysbiosis, whereas something like maybe potatoes are. And then there's lots of edge cases. We can think of things like legumes and beans, things like sweet potatoes. These might be less bothersome. And there are interesting diets that are involved with inflammatory bowel disease that are involved in modulating the microbiome. These are things like the specific carbohydrate diet and IBD aid, or the IBD anti-inflammatory diet. Now, one criticism of SCD and IBD aid is that there's not enough attention that's given to how these diets nourish the microbiome. SCD was really developed before we knew anything about really the importance of all of these microbes, and it was just more about not feeding the bad ones. And obviously we have a much more nuanced understanding, and it's not enough for us to just starve out the bad the bad guys. In IBS, oftentimes it's less about specific starches, and it's specifically a specific type of saccharide, a specific type of sugar called FODMAPs. And we'll go into more about what you can look up FODMAPs, what they are. You can look, there's specific vegetables that people avoid. I think generally for most people, it's overblown. And it might not be an issue, and you shouldn't depend on SCD or the FODMAP diet as, generally super, super long-term strategies. What I've noticed a lot of the time is that people who completely cut out FODMAPs or completely cut out starches in their diet, they often have trouble reintroducing these things. But then let's talk about nourishing, and in one way we can also modulate the microbiome is through antimicrobial herbs. I would be very careful here. I think this needs to be done carefully. We're not going to go through an exhaustive list as to what the antimicrobial herbs are, but you can think of things like wild oil of oregano. And if I was personally going to do an antimicrobial protocol, I'd probably just eat more of these herbs myself in their natural form. And that's one strategy, is getting as much of this in the natural form as possible. But let's also talk about nourishing the microbiome now. Okay, this is really, really important. Why is it important for us to nourish the microbiome? Let's talk about prebiotics, for example. So when you eat, for example, different things like fruits and vegetables, onions, mushrooms, blueberries, avocados, these are essentially, they contain fiber. And this is prebiotic fiber. And the microbiome ferments these fibers into what are called short-chain fatty acids. And these short-chain fatty acids directly feed enterocytes and colonocytes. These are the cells that line the colon, okay, and line the small intestine. And they actually help to create less permeability of the membrane. And that's one reason why prebiotics in both inflammatory bowel disease and IBS are extremely important. And then, of course, we have probiotics. I'm a much bigger fan of getting your probiotics from food. All of you can, eating things like real fermented foods like kimchi, like eating kefir, specific SCD yogurts, things like sauerkraut, and maybe even a little bit of kombucha. And there are specific probiotics strains, in fact, that are implicated in IBD and IBS. We're not going to go through that. Just to give you a quick example, like one probiotic that's implicated in inflammatory bowel disease is Visbiome, and that's only generally has evidence in ulcerative colitis. And there's lots of other ones in inflammatory bowel disease, and there's specific ones in IBS. But again, I think it's really unknown in IBS exactly what strains are working and which ones are not. And you really got to go through that and define it yourself. I would just advise you to be careful with specific soil-based probiotics. They can often be harmful in these conditions. So then obviously let's talk about things we can do that involve soothing the gut, okay? These are, eating foods that are high in like gelatinous fermentable fibers, blueberries, avocados, bananas. And interestingly, to get the full benefit of anthocyanins and flavonoids and polyphenols that are found in dark berries, those types of things, you actually don't want to eat them with bananas. This actually came out that there is a specific enzyme that are contained within bananas, for example, that may inhibit flavonoids and that actually may inhibit flavonoids and polyphenols, specifically anthocyanins, from having their full effect, and actually might cause the premature breakdown of them. Now, what are some supplements and herbs that might help with barrier? This idea of maintaining the integrity of the barrier that we talked about up here in our seal the barrier in IBS, repair and maintain the barrier in IBD. These are things like glutamine, especially in Crohn's disease and the small intestine, less implicated in IBS or ulcerative colitis. Sodium butyrate, I think this is important, something we know. This is where butyrate plays a role right here. It's a short chain fatty acid, so you can directly supplement it. Phosphatidylcholine. Phosphatidylcholine is a phospholipid that is found in the colon, in the cellular membranes. And there's been several studies with ulcerative colitis that have been done. And I also have seen good success with phosphatidylcholine in IBS as well. And then we also have serum-derived bovine immunoglobulins, SBIs. There's evidence in both IBD and IBS with these guys. And this actually, interestingly enough, not only do SBIs maybe play a role in maintaining barrier function, but they also might do a little bit of modulation of the microbiome because they tend to bind microbes as well. And then we have herbs like marshmallow and slippery elm there is direct evidence with things like ginger and peppermint oil in irritable bowel syndrome. So it's a lot. There's a lot of different ways for us to think about these, and it's almost like if sometimes it feels like we're talking about the same condition, but we are really, really not. And the nervous system and the gut-brain axis plays a role in both inflammatory bowel disease and IBS, like I said, but things like meditation and hypnotherapy, biofeedback. I love a meditation timer that I use called Insight Timer. Finding relaxing activities that you can do. I like to take a hot bath and a cold shower. If you do sauna and cold plunge. Nerva is a very interesting app, and I've seen a lot of success. They have an ad campaign that's saying that IBS is not caused at all by the foods you're eating. I'm going to just go ahead and call BS on that. It is a combination approach. Is not all. If you have IBS, this is not something that's all in your head by any means. I've seen, again, strategies that modulate the microbiome, nourish the microbiome, dietary changes have absolutely revolutionary effects for people with IBS, whereas just, meditating and hoping that it goes away is not enough. But these are all things that need to be done together. So guys, let's remember how we can sum this up a little bit. IBD is a more defined diagnosis. IBS is a less defined diagnosis. IBS is more common, like we said, but there are, even in IBD, there are likely hundreds of subtypes, and in IBS, there's probably even more subtypes. And what I want to say is that with both conditions, the idea of systems-based health coaching is to create your remission master plan, your health master plan, and find a protocol that is working for you. And to use tools we have in our program, like the adaptive dietary framework. It's not just about the foods that you are taking out of your diet. It's about the foods that you're incorporating, when you're eating, how you're eating, what's the texture of the food, how your medical and health team understands what you're doing, how you're working with your mainstream doctors, your alternative doctors, and really deciphering what works for you, what doesn't, what's scientifically based and what's not. And understanding that just because you ate a food, that doesn't necessarily mean that it's going to have an instantaneous reaction. It could, but it might take some time for that to have an effect on you. Like even, for example, when I eat a starch, I actually feel really good with my inflammatory bowel disease, and I don't experience any inflammation or anything till 24 to 48 hours later. So again, you got to find the pattern that is going to work for you. Let's go through our steps to just sum this up one more time. IBD, stop and control inflammation, modulate and nourish the microbiome, repair and maintain the barrier. Those are the steps you're going to take right there. And that's what we would do if we work together. 4-step process in IBS is calm the nervous system. I actually have a degree in neuroscience and psychology. This is something that's very deep to me. And we know, as you know, Systema is based on the principles of neuroplasticity, this idea that the brain can change, okay, and systems thinking. Modulate and nourish the microbiome, seal the barrier, and quell inflammation. Overall, you got to find the pattern that's going to work for you. I would love to work with you. If you have inflammatory bowel disease, let's jump on a call and you would enroll in our very built out program called Systema IBD. We've worked with hundreds of IBD patients. If you have IBS, you would enroll in Systema one-on-one with me, and I would love to work with you. If you have both of the conditions, then I think we are more prepared than anyone to work with you. Sending so much love. I believe in you. If you are in the throes of a flare right now of either your IBS or your IBD, there's hope for this. You can look at the link below to schedule with me. And I hope this was helpful, regardless if we work together or not. I'm just trying to put out information. Remember, Systema Health is changing healthcare all around the world. That's what our goal is. We're working with one patient at a time to empower them, for you guys to build your ultimate protocols, work with incredible medical and health teams, and really to take ownership of your health. Love you guys, and I'll see you in the next video.